Citizen TV. Indeed, we are glad that you're keeping it Citizen TV on this 3rd day of November 2017. It is a Friday. Welcome to the program. My name is Wahiga Mwaura. Shortly, we'll be taking a look at the headlines in the papers, and to help me do that, I'm joined by two panelists. Of course, we're expecting another two others. We're expecting Dan Manzo, Member of Parliament Makueni, and Ruth Ambogo, a political analyst, political commentator. She'll be joining us shortly. But at my far right, Brian Mutie, governance expert. Welcome to the program.
Thank you, Wahiga.
And of course, Dr. Stanley Karanja, another governance expert. Welcome to the program as well.
Thank you so much, Wahiga.
Indeed. Let's take a look at the headlines in the paper. We start with the Daily Nation, and some good news after what has been a very trying period for Kenyans with 2 election cycles and so forth. One can say that there is good news here for all Kenyans, and the title reads as follows. That should be coming up on your screen any minute now. Relief as nurses end 5-month boycott. And let me just read what the key highlights are. A national health crisis that had crippled services in public hospitals, giving rise to considerable agony and frustrations for millions of patients, comes to a stop today as more than 25,000 caregivers, this is Daily Nation, not the Standard, agreed to a new deal giving them higher allowances. And the new deal is as follows. Number 1, a collective bargaining agreement shall be concluded and signed within 30 days. All disciplinary cases instituted against the nurses, yes, you can see that on your screen, during the period of the strike shall be withdrawn. Number 3, withheld salaries will be paid into the nurses' account by the end of this month and not later than the end of December. Number 4, all court cases related to the industrial action shall be dropped by the parties, save for one on the grading structure of the nurses. And finally, the nurses' union calls off the strike and directs its members to report to work immediately or not later than this evening. The agreement was signed between the union, governors, and the health ministry. And of course, this subject, because today we do not want to engage our viewers on matters politics, but on health, which has been a real serious issue. And that's why we're asking you today, in what ways did the nurses' strike personally affect you? In what ways did the nurses' strike personally affect you? Are you a caregiver? What is your take on this new deal? Are you someone who's had to suffer because of the nurses' strike? Has it affected someone you know? Talk to us on 22422. That is our SMS line. And on social media, use the hashtag PowerBreakfast. On Twitter, on Facebook, at Citizen TV Kenya. We value your feedback, and I'll be reading your SMSs throughout the course of this program. But Brad, let me start with you. The world has been talking about Kenya's political crisis. Kenya's political crisis has been discussed on basically all major international media outlets. Yet there are those who say that the real crisis has been in the health sector. I'd be interested to get your take.
Thank you, Wahiga. I think politics supersedes everything, and it takes the center stage whenever issues such as these do arise. And Kenya, of course, has been attracting that kind of attention, globally speaking, because of its geopositioning in terms of how well we are located strategically to ensure other countries can use us as a launching pad to spearhead their interests. And you can ascertain this because wherever East and West are actually spearheading their interests across the region, in Africa, Horn of Africa, Sub-Saharan Africa, Kenya has always been the launching pad, and therefore that when things go wrong here in Kenya, Wahiga, we are always told that business is not as usual, things are not going to be rosy as long as we are not going to toe the line according to East and West dictates. But again, we have a serious issue in terms of a health crisis in this country, because this has been a chronic issue that has been actually coming over every year. There has been some grievances. Before the nurses, of course, you remember, Wahiga, there was also the 100-day strike by the doctors, and that crippled the health sector. Now after that, the nurses came in, and after that the clinicians also followed suit in terms of these strikes. And that begs the biggest question. We had devolution come into perspective, and that was a very well choreographed document which ensured that we devolve a sector such as healthcare. But we do ask ourselves now at this moment, are we there in terms of devolution being able to sustain the health matters in this country, or is it the high time that we also need to rethink about the matter of the positioning of the health docket, whether it has to be fully devolved or we have to actually maintain it at the national level? Because you can see the
what would be your recommendation? I know from I guess a layman's perspective, what do you think would work best?
I think it would have still maintained at the national level, where it would have been, you know, managed centrally, because we did rush the aspect of devolving some of these sectors which somehow are sensitive. And it would have been good if we had actually taken some time and gradually, you know, there is also the aspect of gradual development of these services. It would have taken some phases. Some counties would have actually run as pilot counties, and these would have actually ensured that we understand the principles of devolution as far as healthcare is concerned. But the moment we just said let's blanketly devolve healthcare without the structures, without the proper frameworks at the county levels, that brought a quagmire and the crisis that we are finding ourselves, because politics have to take center stage. If you see the group that maintains or that manages matters of the counties, the COG, it's a political group, and they have to ensure that as much as their interests are also spearheaded the counties, because this is a physical issue. And when I talk about physical, is the financial bit of it. You realize that counties get money in a not so regular manner because of other factors that we all know, and because they cannot plan properly on how to remunerate these doctors and the nurses, it is a high time that we actually find a recurrent budget within the exchequer, which is now ring-fenced actually to cater for medics across the county, so that this crisis does not happen. Just like another civil servant within the mainstream civil service. Okay.
Dr. Karanja, I want to ask the same question to you. Again, do you feel that so much focus has been on the political crisis that the health crisis actually suffered? In fact, if I could ask it another way, if the nurses' strike had happened last year or the year before, would it have been resolved faster? Because we would not be talking about 2 election cycles.
Thank you so much, Mr. Wahiga. Here, I look at it differently. I look at it at the issue of leadership and governance in totality. In this country right now, we are suffering from political. Everybody is talking political and legal stuff. We are not thinking about, and that's why nurses' strike did not take center stage in many of the things that were happening. Come to coverage in the media, everywhere else, everybody was in politicking, whereby we lose it when we are not thinking in totality. And it's very appropriate that we should always be thinking as a country on matters of politics, economy and social, which are enshrined in the Vision 2030, the 3 pillars. And we think even when we are electing the leaders that we are electing, are these leaders politically, will they lead us politically with the envisioned the visions? Are they going to be able to think about economy? Are they going to think about the social well-being? Are they going to think about the enablers that will make our life more better as Kenyans? And that's why we lose it as a country. And you see, we had the nurses strike, hospitals, everything had gone dead. Yet everybody had focused on politics. And that's the big undoing for our country, which we need to start changing and thinking positively. Even the total citizenry, we need to start thinking, who is this leader? Is he thinking about our economy? Is he thinking about our health issues in totality, our infrastructure? And that's why you'll see all the dimensions that are affecting our country today, even the economy. Because
in your assessment, and even as we look at the headline, it talks about how this deal was signed in collaboration between the national government and the county government. Yet the story doesn't quite tell us who ultimately was to blame for this 5-month strike. Who do you think was to blame for this 5-month strike? Because we can only talk about how it will never happen again if we figure out where the problem was and ensure that we rectify it. Or is it a question of, thank God it's over, let's move on now?
It is very unfortunate we are talking about the nurses calling of the strike, then we're having the lecturers.
Okay, so we've left from one
this issue
to another.
It's like this country we are now, politics and the strikes. And there is a lot of, these are things that we need to, and we need to start thinking about the civil society. What type of civil society do we have? And how are we going to run this country? And how does it affect our economy? And all this will balloon even about devolution. And there's a very good question you had asked my fellow colleague here, what do you think about devolution? When we are thinking about the presidency and what we have seen what happening in this country, that every focus has gone to presidency. We also need to start, did we go wrong even having the 47 counties? Did we go wrong? Because it was one of the key factors was to devolve that power thing, power hunger for the communities to be.
It still seems to be very much.
In fact, people have forgotten their governors. People have forgotten their governors in this country. Everybody's check the Standard today. Paul Baka is now
front page.
Front page, 2 guys only. Why are we not seeing the 47 people? It's very unfortunate in this country. So devolution then it means it's not working because we want to devolve power again. And I appreciate we have the likes of Dan Manzo, Mheshimiwa. Good to see you this morning. And I know he's looking at me because they are the people who crafted this constitution. And I will tell you, even come to the economy side, we are going to suffer in this country. In fact, when the discussion is coming about how do we now go forward, and this issue of can we change the constitution, we need, if we are going to do all these parallel things, people they are saying we'll have official opposition ideas and all that. We also need People's Assembly, all those kind of things. They're also going to eat money. We need now also to think, do we also need the 47 county government?
Fair enough. We'll come back.
Because those are the issues that we cannot even agree
so much.
On the health sector.
Let me allow Honorable Manzo, welcome to the program. Ruth Ambogo, political commentator, welcome to the program as well. Ruth, you've obviously now had a chance to listen a little bit to what Dr. Karanja had to say. We're talking about the nurses' strike. Good news, relief as it ends, but nevertheless, we need to ask ourselves, why did it take so long to be resolved? I want to get your take on this.
You know, when the show started, I heard you ask a question as to whether the citizens have been affected by the strike. I wasn't affected by the nurses' strike, but I remember I was affected by the doctors' strike earlier on this year.
Personally affected.
Personally affected. I fell sick. I had an emergency case. I had to go to over 5 hospitals in Nairobi because you know I could not receive medical services. And I think for me, at that point is when I began to think critically about our health, you know, within the country. And I've had a chance to at one point run a project, a health project in Kakamega, just to inspect especially maternal mortality rates in Kakamega. And you know, one of the, I think for me when I talk about health, I begin to look at it from the perspective of being a woman, being a young woman who at one point will be able to, would want to access health services, you know, maternal health services. It is said that, you know, the maternal mortality rate of a country determines whether a country is really achieving their development goals or not. If mothers can be able to safely give birth or not, that's when it's one of the indicators of whether a country is doing well or not. You see, our constitution says that every person is entitled to the highest attainable standards of healthcare services, and that no one should be denied emergency healthcare services. But when you have doctors striking, and yet we know that life is at stake, you know, I think for me, I always look at it from the point of view of if life is at stake, then it needs to be given priority. If we're going to see people dying because they cannot be able to access medical health, we need to begin to think critically about these issues, and that's where the question of should we politic at the expense of the livelihoods of citizens, you know, and over and above considering this nurses strike, we need to begin to think about community health workers, because in Kenya and in most rural areas, whenever there's a nurses strike, it is the common wananchi who is affected. That's the woman back at the rural area, the young boy back at the rural places. We saw people getting hurt during the strikes. I mean during the riots and the demonstrations, and they could not be able to access healthcare services. Some of them died in the process. Over and above that, how many people have been unable how many young women and mothers have been unable to give birth because there are no nurses, and that now puts burden on hospitals such as Kenyatta National Hospital, because now they don't even have the capacity to handle the number of patients that come to the hospital to seek for medical care, because I understand that in Nairobi, Kenyatta National Hospital is the only one where nurses were not striking. So what about the burden that these hospitals have to bear? So I think we really need to consider this issue. Over and above the nurses strike, we need to now sit down and have a serious conversation as to what is the plight of community health workers, because back at the rural areas, people access healthcare services from community health workers.
Through them,
yes, and they're mostly never paid, So this is seriously an issue to talk about. And you see, we have seen county governments that were able to come in when the nurses strike was beginning to affect the livelihoods of their constituents. They sat down and struck deals with we saw
Nandi County.
We saw Nandi County. We saw Ngilu, striking a deal with. In fact, I think she was one of the very first ones to do so. We saw what's her name, Kirinyaga, Anne Waiguru striking a deal with her nurses and paying them. So then that's where the question begins. That's where you get the question.
Yes.
What about everybody else? Who really is in charge, you know? Yeah,
okay,
so...
Okay.
Yeah.
Let me bring Honorable Manzo into this discussion now. Karibu Mheshimiwa.
Yes, thank you.
Good. Even as we celebrate the fact that the nurses strike has been, nevertheless, concerns that politicking has affected, in fact, you know, it could have been resolved earlier if it wasn't for the fact that the nation was so distracted by politics, is what some feel. But now others are also asking, why did it take so long for the nurses strike to be resolved, and why the back and forth between national government, county governments, Sarah Serem's organization, and you know, so almost the person at home doesn't know ultimately what went wrong, so that if it happens again, you know, we know how to fix it. You know, first I can allow you now to weigh in on this discussion.
Yes, first of all, when the nurses went on strike, they came to Parliament. And also when the doctors went on strike, they came to Parliament. And we called in a few doctors, and we sat with the Deputy Speaker then and looked for a legal solution, because part of it is legislation. And there is already proposed legislation that you know, you must tie the national government with the county's government. As much as we have having devolution, there are serious issues which have not been tackled practically by devolution, especially the matter of the health sector, which is now devolved. You know, you devolved the doctors, but don't devolve the finances. Finances have, you know, even right now, counties have not received their share of monies which we passed as Parliament, and you know, when counties have no money, they can't move, and automatically the health sector is affected. And you know, previously, before devolution, you know, this was handled at the national levels, so the monies were left at the national level, handling a few things here and there, you know, the organization of the health ministry, some of the purchasing power still at the national level. So it's not properly structured, and I think we need a law which now finally settles all the issues of devolution, so that the health sector is fully devolved and taken care of at a devolved level. But right now, a lot of activities are still at national level, procurements.
What would that law look like?
Well,
I know you might not have the full picture, but in terms of
we are looking at a situation whereby probably you will even have a commission of some sort, whereby most of the issues are determined there, you know, dealing with the health, the payments, the transfers, so that there is a medium. Because you see, what is happening illegally is you have a CBA which was prepared probably before devolution or during transition. Then it is not properly a county law, nor is it a national law, and it needed a little bit of a polishing, so that everybody knows what are the terms, how are we going to do it, the money is going to be delivered on time, and who is responsible. Is it the national government, or is it the county government? So national government remained responsible for so many things, but at the devolution level, the action was there. Activities are going on at devolution level. There was serious disjointment, so that there is no tie of the two, and you know, there is what you call shared function between national government and county government. And though you know only 15% to 30% at maximum goes to the counties, then you have 60 or 90. Sorry, you have 70 to 60% still at national level.
At the national level.
And that's why the politics come in. Okay. That's why you are finding the presidency. Whoever takes it, have it all. Whoever loses it all. Yet the country is divided into two. And therefore, you
health related in many ways. I can tell a lot of parallels from what you're telling us. Yes,
you know, health comes in. You have a minister for health. What is his role? I only see him in examination. I only see him in other things which are not necessarily health, because the health is devolved. So when you go to everybody, they tell you, oh, health is devolved. Ask the governor. But who has the stake? The stake is of the national government. That's why the deals are being done.
So are you accusing the national government of being what, insincere?
It has been insincere on this health matter. There has been no practicality. Parliament is somehow run by the executive. Unfortunately now, we are heading up in a situation whereby whatever legislation is proposed by the executive is what Parliament passes as a rubber stamp. A debate is no longer a debate. You know, it's like a set thing, and whoever member of Parliament, let's say of Jubilee or the government, tries to challenge the executive in one way or another, we will never see their seat again.
Would you completely absolve the governors from this 5-month NASA strike? Would you?
I don't think the governors handled it.
To swear about who is innocent and who is not.
I don't think the governors handled it in the best way.
Okay.
I don't think the governors handled it well.
Fair enough. We'll come back to that. Of course, talk to us on 2242. We're asking you, in what ways did the NASA strike personally affect you? Talk to us on 22422 and on social media as well. Use the hashtag PowerBreakfast. Interestingly, on the front page, a lot of good news regarding, this is the Daily Nation, regarding the NASA strike relief as it ends. But on the back page, NHIF cut number of outpatient visits. And for those of you who may not have gotten this news yesterday, let me just touch briefly on it. The National Hospital Insurance Fund has reduced outpatient visits to only 4 per year per family. Let me make sure I've gotten that right, 4 per year per family, contributing to the national scheme, bringing agony to poor households that cannot afford healthcare services out of pocket. And of course, before that, the number of visits was unlimited. And of course, the story has a lot more details about what has been changed, what has remained. There is also some good news. For example, NHIF has said it would not require or no longer require members to pre-select health institutions for outpatient services, in a move that would ensure all those covered by the scheme get timely medical help and make the insurer more popular. Brian, let me come back to you. I don't know if you got a chance to see this. Sure. If you did, what was your initial reaction?
Sure. I think NHIF has been moving from one, formation to another, coming with different packages time and again. And initially, of course, it was sort of a dull affair, but at least they have improved. They have looked a little bit more colorful in terms of the packages that they have. I think one of the striking benefits that I could deduce from the provision they gave yesterday was actually the scrapping of the selection criteria, where somebody is supposed to select some for certain facilities where he has to or she has to attend for medical attention. But again, the limiting to 4 actually now that brings out neutralizes the whole gains that they had actually made as an institution.
It's a situation of giving with one hand and taking away with the other. Is that what you feel?
Absolutely. And of course, we cannot forget the goodies that they have also been announcing, that issues which were actually mission impossible, like the MRIs, CT scans, cancer screening, dialysis, some of the issues that they have also taken up are some of the good issues that we can relate and give them some kudos on that. But now we have actually to ask ourselves whether some of these issues are sustainable. Look at the amount that they do collect per year. It is a huge amount of money, and the services seems to be not consummate with the services that they give, the money they collect. And therefore there's a need for actually looking at the issue, the whole framework, and coming up with the better provisions that would be actually be comfortable with the local mwananchi. Look at the local Kenyan who cannot afford the healthcare facilities that some of us are able to attend. That person can only, this is the only hope that gives Wanjiko that kind of hope in terms of accessing better medical healthcare. And therefore, the moment you now limit to 4 times in a year, I think you are now taking the food further from Wanjiko, because he is contributing also every month, or the regular contribution. But when you say it has to be 4, then you can also make it 4 times contribution, or contribution which is commensurate with the number of medical visits that you are making, so that you don't seem, the institution does not seem to be gaining a lot from one hand and giving little from the other side. And there is need for proper understanding of the whole NHIF framework, so that when they call it a universal medical health care for Kenyans, it is really a universal.
It's actually that. Dr. Karanja.
I think NHIF is growing from one stage to another stage, which we must appreciate. Previously, you could go only to the pre-selected healthcare provider, but now you're looking at a situation whereby even if you have going to have is the 4 visits, how many times do you go to hospital? But again, in this hospital, what the quality service do you get in that hospital? now that you are in that particular hospital, you see it was also compromising the quality of service from that particular provider. Now you have, and they have also, one key thing they have opened is to go to the Aga Khans, the current hospitals, and they will also be able to pay. So you see, even those people who had never thought that they can go to Aga Khan now have an opportunity. When they have a certain condition, they can be able to know that this is where we are going.
You're almost choosing to see this as a situation of a glass half full.
Yes. Yes.
So what happens to those who have pre-existing conditions and they know that they must go more than 4 times a year? What happens to them?
In fact, let me say this. It depends how you look at it. Half full or half empty, the glass.
Okay.
And you'll see how
you're half full.
Yes, exactly. And that's why we have many panelists. I know they'll go half empty, and I'm going half full. And that's why you'll see here the bad news of families on NHIF cover. In fact, I don't know how the newspaper thought of that. Particularly like myself, I contribute to NHIF. I've never used my NHIF. Why? I always pay for other provisions. But with this, I know now if there's something I need at current hospital, if there's something I need at Aga Khan hospital, I can be able to focus and get proper quality care. And that's, I think, that's the positive side of it. That's the positive side. Now, let me say this. Do you know why even diseases sometimes affect people? Because of immediately when you are being diagnosed, you are diagnosed with the wrong thing. Then from there, it gets worse. But now you'll be able to start, and this is the awareness that we needed to start looking at. From this step that NHIF has taken, remember the big issue, if you read the newspaper very well, there was the issue of nurses strike, which maybe they never think. Because when there was nurses strike, many people could not afford to go to the private hospitals.
Yes.
Now that it has been called off, now the government, the healthcare, maybe they may review it, but I think this is a step forward, which they were dealing with the situation whereby the nurses are on strike.
Okay.
Now
so you do have no problem with limiting the number of outpatients?
No, the number of visits I cannot comment because I don't know how they calculated. Remember, again, it's a fund.
But from where you sit,
remember, it's a fund. The problem, if you follow the story of NHIF, there was a problem of misuse of NHIF fund by most of the healthcare providers. They could not even be able to track. And I think these are the good options that you can call even the CEO, Jeff Mangi, to explain why is it exactly. Because it must have come from a certain statistics, from a knowledge of understanding, not just... It's not
an attempt at cost cutting from where you stand or...
Remember, just the other day, you know, this fund can even go down if people are allowed to do like the way they have a good vision and mission for this country. But the issue is here. Understand also the organization from perspective. It was in the other wars just the other day that people were having very big bills to the fund, and there was that crisis again. Now they have to manage and be able to get. They have to manage and get it right and quality services provision.
You know, it's very simple. A healthy nation is a wealthy nation. I mean, the moment you have, when you have very many citizens unable to access healthcare, and to me this reduction of the number of visits will definitely affect a high number of, a huge population of the country, in the sense that, I mean, you have especially children who tend to fall sick a lot, quite often, and the elderly who are always, accessing medical health care. So basically what you're telling that old grandmother who has arthritis back at home is that she can only go to hospital 4 times. And many of them...
choose which predicament you want to go to hospital
exactly,
for.
Or choose, exactly.
For others, ignore them.
For others, ignore them and take care of them. Take care of them on your own.
Yes,
I mean, if NHIF previously could be able to accommodate people going to hospitals as much as they wanted, what's the change? They need to properly give us, explanations for this, because they're saying they want to reduce the level of fraud, they want to reduce fraud. I mean, they need to tell us exactly how has this fraud manifested itself. Why would I go to hospital to defraud NHIF? Why would I go fake illness? Because basically what they are telling us is people have been faking illness to go to hospital. I don't think anybody would fake illness to go to hospital, because they are saying their primary reason as to why they are capping this number of visits is to limit cases of fraud. So I really don't understand how children would defraud NHIF, because most of the times people who end up accessing hospitals oftenly are children, young children, they're the elderly, accident victims. What will you do to an accident victim who needs to constantly go for checkup, So I really think they need to come out clearly and tell us it is either we don't have money, it's either we are unable to cater for the entire entire nation's population, and from there on then we begin to have a conversation as to then what next should we do. What should the Ministry of Health do to ensure that this NHIF, is probably funded better, because I think Kenya receives, I understand that Kenya receives funds from World Bank and other international donor organizations to go towards health. How is this money used? I think this is a critical time to start having a national conversation with the experts as to the health situation in Kenya, because today it shall be NHIF, tomorrow it shall be we no longer have free maternal health care. So therefore what happens to our country? Slowly we will get to a point where every subsidized healthcare service that we are receiving keeps on getting cut off, and so then where will that lead us to? In Nairobi alone we have 60% of Nairobi's population, which is like 3.5 million Kenyans, Nairobians living in the slum areas where they are prone to communicable diseases such as TB and all these other diseases that will require them to always go to hospital. What are we saying to these people? We need to have a serious dialogue.
In on this.
Yes, first of all, I think we need to strike a balance so that the fund is managed properly, and that you can know what is coming in and is it able to sort out all the insurance cases. And you can see a lot of counties have begun a similar method, of working with the NHIF, and even people making contributions, even patients pay 500 shillings. I know in Kitui, the Honorable Bongilo announced 1,000 shillings, and you can be able to be treated. So the patient is contributing, and I believe also Treasury is making a contribution. So we need experts to analyze NHIF to make sure, first of all, it is able to perform its functions. And some of the the deductions are mandatory under the law. And therefore, and some people are very lucky, hardly visit hospitals. Yes, some people are genetically healthy, so that because of their genetics they can be able to survive other diseases, and others get prone to illness because of conditions and things like that. And it is not, the healthy situation is not just about the hospitals and the treatment and sickness. There are many other factors which contribute into health status. You saw what happened when it rained in Mombasa. Floods come with their own troubles. So we need a situation whereby the government invests in infrastructure so that waterborne diseases are avoided. You need also to make water provisions. You saw there were outbreaks recently, in town and other places. The moment you have water provisions, then it reduces diseases by half, and therefore automatically that affects what is happening in the NHIF and the health sector. So we need to look at all the sectors which in one way or another affect health, like the water sector, the drainage systems, the infrastructure systems, so that then that in a way reduces the number of times a patient is going to visit, and that may stabilize the fund. But the government needs, to substitute it in a way so that the Mwananchi is contributing and the government is also as a budget which cushions it so that it doesn't collapse.
That's correct. So a balance needs to be struck. We need to take a break. I know you want to come in. We need to take a break. Hold your thought. But what I'll do is I'll read a few SMSs which you can also touch on the other side of this break, and even as we take a look at another topic in the papers. Let me read some SMSs now. You don't give us your name, but you say health devolution is a mess and done poorly. The government should have dissolved monies to finance services, but never the personnel. Devolving personnel resulted in being subjected to different treatment. Others promote, I think other counties promote paying time, pay well, no discrimination, no intimidation, while other counties do the total opposite. This is unhealthy for health. Somebody here says, I'm a contributor, yet NHIF cannot have my tooth filled na nimebakisha one molar. Kwani meno still part of me. Someone is asking you, Ruth, and you can answer when we come back. Please clarify. When you talk about community health workers working as nurses, is that the correct position? Because they feel that a CHV can never be a nurse. I'll give you a chance to respond when we come back. And for you, someone is saying, please ask Dr. Karanja to explain to us I don't know, okay, you don't represent NHIF, I think we need to clarify that. But anyone can answer this.
Yes.
Does this mean 4 visits per family or per individual? If so, does it mean that they envisage that a family of 6, only one person can go 4 times? And then also they're asking, is your panel aware that people from a lower social class go to hospital more frequently than those from high-end families? We take a break, we get answers to those questions on the other side. Please keep SMSing us about a very important topic. We've talked about politics for so long as other matters happen in this nation, and today we want to really pay attention to what's happening in the health sector, and then later on we'll touch on politics. 2242 is our SMS line.